Okay. So I'll fix it in a few, a few moments, a few. Let's just move on to the listening module. I'm sharing the screen. Is the screen visible to you guys?
Yes, sir.
Okay. So we are into the listening module, and you are looking at the test overview at the moment. Have a look at the just the listening section, which says that it is about approximately 45 minutes. If you can please anyone read it loudly. We did it the last time as well, but it is just to begin with now the complete reading listening module. So just look at the listening module, and any one of you can please read the listening area.
All right, I can do it. So for listening, it's approximately 45 minutes. It is same content for all healthcare professions. Follow and understand a range of health-related spoken materials such as patient consultation and lectures.
Right. So under this module, you will come across 42 questions, and these 42 questions you will be solving on listening to a recording. Okay. So unlike your reading task here, you have to actually listen to the audio. The audio could be related to the consultation, right? Or maybe it could be a lecture. It could be some sort of demonstration given, or somebody highlighting the guidelines for particular method. So under the module, what we will have is, I'm going to display now. Uh, Clarissa, if you can read the first paragraph, please, about the OET listening subtest,
The
please.
OET listening subtest consists of 3 parts and a total of 42 question items. The topics are of generic healthcare interest and accessible to candidate. So after that, I cannot see the screen because it's blocked by something.
Okay. Now is it visible?
It's still blocked by the
Tricia, can you? Is it visible to you, Tricia?
Oh, now I can read it, sir.
Yeah, please go on.
Okay, accessible to candidates across all professions. The total length of the listening audio is about 40 minutes, including recorded speech and pauses to allow you time to write your answers. You will hear each recording once and are expected to write your answers while listening.
Okay. So again, it's just a simple structure, so suggesting the structure. Kylian, please, if you can read the part A.
Part A, consultation extract. It's about 5 minutes each. Part A assesses your ability to identify specific information during a consultation. You will listen to 2 recorded health professional patients consultations, and you will complete the health professional's notes using the information you hear. Note, the health professionals may be any one of the 12 professions who can take OET.
All right. So if you look at part A, okay, so it looks like this. Okay. Right. You have the extract 1 here, and you have the questions from 1 to 12. In the part A, you have questions ranging from question number 1 to question number 24. Okay. And the question types are simple, gaps filling exercise or sentence completion exercise. These are very simple just because you have to take down the information. Okay. So here the patient is Ray Sands, and the person is describing about his, problem that he's facing, and the doctor will be asking certain questions to the same person, and then you simply have to understand the notes and then go about it. Uh, it is it is a very sophisticated test. The moment it begins, it will give you proper instructions. It is really important for you guys to listen to the instructions carefully. You will also be given some time, let's say around 30 seconds to before the audio starts, so at least you can have a look at, let's say, some information about the patient, about the question number 1, 2, or maybe 3. So try to have a look. Question number 1 states that back injury sustained because of some reason. The person might have gone through certain, issue, and that issue is caused by certain, action that he has taken. So you have to put that as the answer. Likewise, for question number 2, patient's description of symptoms. So he is talking about where the pain, he is observing the pain. Likewise, as I mentioned earlier, you will have some amount of time to go through the questions. However, once you are listening to the recording, you can analyze how this questions are structured and how you got to answer them. Okay, so we are just solving first 12 questions first. Okay, and we'll it is just a trial, so we'll just have a look like whether you can grasp it or not. I'm gonna keep sharing the screen, and so that you can put the answers according to the sequence on your notebook. And I'm hoping that you have your notebook and a pen ready to answer for the questions. Okay, you have. Should I start the recording now?
Sure, sir.
Okay. And remember, you have to write the answers on your notebook. Once the recording is for the 12 questions is over, we'll check the answers. In a minute, I'm going to put the recording on.
Occupational English Test. Sample Test 1. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. Extract 1, questions 1 to 12. You hear a physiotherapist talking to a new patient called Ray Sands. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Come in. It's Mr. Sands, isn't it?
That's right, Ray Sands.
Now, I think you've been referred to me because you're suffering from sciatica.
That's right. Not for the first time, actually.
OK, well, I've got some notes here, but perhaps you can tell me in your own words about any previous bouts of sciatica you've had, what treatment you had, what worked for you, anything else you can remember.
Righto. Well, it all started when I hurt my back. About 18 months ago now.
OK.
I was giving somebody a hand with a heavy suitcase and I felt it go, you know, woof, just like that. Anyway, I slowly got over that, despite occasional flare-ups. And then, out the blue, about a year ago, sciatica developed. And it was 6 months till that finally cleared up altogether. Now it's come back in the last month or so, I'd say.
I see. And your GP said it was sciatica?
Yeah, I had this pain all the way down my right leg, and she said the real problem was in my back because the sciatic nerve was getting trapped.
Right.
I mean, I'm telling you, this was no ordinary pain. It was really intense. I mean, to the extent that I couldn't stand for very long, couldn't walk hardly any distance, I couldn't sleep.
Oh.
I mean, the most frustrating bit for me was that I couldn't even turn over in bed. It just hurt so much. I just couldn't get comfortable. Do you know what I mean? Sometimes I'd have, sort of tingling feeling in my calves as well.
Right.
But then at other times, my whole leg just felt a bit numb, really. It was weird. And of course, I couldn't go to work. I'm an events organizer, so I travel about a lot. I'm setting things up for conferences, lugging stuff around, And so there was no way I could manage any of that at the state I was in.
Okay. So, how was this treated?
Well, in the first instance, I was given painkillers, obviously. Ibuprofen, as far as I can remember.
Right.
And I was told to put compression packs on the affected area. I mean, that did ease the pain a little, but I was still housebound, practically speaking.
Okay.
Then the GP sent me to see an osteopath, and I got some treatment there, but it didn't seem to make much difference.
Right.
So I was referred to a sports injury specialist, of all things. And he did a number of things that did seem to ease things a little, like working on my spine and lower legs.
Mm-hmm.
Oh, and he gave me a set of exercises to do at home.
I see. Any other treatment?
Oh, yeah, I almost forgot. There was this course of injections, and I went for various other therapies, like ultrasound, and another one where they do, well, they use like electrical impulses.
Mm-hmm.
I can't remember exactly what it's called.
Okay.
At one point, I even considered acupuncture, but by then, the other things were beginning to take effect, and the symptoms were subsiding, so I gave it a miss.
Mm-hmm. So, which of these various treatments do you feel was most effective? What made the difference?
Well, I couldn't say for certain because it all went on for 4 months without much improvement, really. Then it wasn't until suddenly in the 5th month, things changed quite dramatically. So to be honest with you, I think it was the combination of treatments gradually taking effect and coming together rather than one single thing making the difference.
Okay. And did anyone ever talk to you about what might be causing the problem?
Well, I think everyone assumed that a slipped disc was behind it all, but
Right.
it was never actually confirmed as that. I mean, I know there is this other condition where you get a lot of pain in the buttocks, but that wasn't my experience.
Okay. And did anyone talk to you about aspects of your lifestyle that might be contributing to the problem?
Well, I remember actually there was one of the therapists.
Okay. Was it loud and clear to you guys?
Yes, sir.
Okay.
Yes, sir.
All right. So we'll quickly check the answers. I'll dictate the answers. You guys please try to reconfirm it. Okay. For the first question, the answer is a heavy suitcase or just suitcase. Either of them is correct. For the second one, the answer is the right leg or his right leg or simply right leg is also. For the third, the answer is really intense or just intense. Either of them will be okay. Then for the fourth, turn over in bed or get comfortable. Either of them will be correct. Tingling, fifth one. Then for the sixth, it's events organizer. And then for the seventh, it is compression packs. For eighth, it is osteopath. For ninth, it is ultrasounds. For 10th, it is acupuncture. And for 11th, it's combination of treatments. While for 12th, it is slipped or herniated disc. Okay. So, Lang, can you tell me how many are correct? Tricia, Clarissa?
I got 3 wrong. Others all I got the answer.
Question number?
I can't get the answer for the pain locate because I missed it. And then the occupation and also the number 11.
Okay. And Liang?
I got one wrong, sir. So smart.
Okay.
4.
Which one was that? Sorry?
Number 4.
Number 4. See, these are like, phrases. Even if you simply, what I'm trying to tell you is that when a person is making a sentence or structuring a sentence, so the sentence will be having certain words that are helping for the structure. Okay. For example, can I get a bottle of water, please? Or can I get an ice cream, please? So if you're talking to let's say a shop owner and you're asking for an ice cream, you may structure the sentence like, please can I get a vanilla ice cream? Okay. So the structure is important. However, the more important is, even if you simply speak vanilla ice cream, so you will get the person will get the meaning what you're trying to say. So these words are keywords, or these are called meaningful words. So you may write turn over in bed or get comfortable, or if you can get an idea of the sentence, like what the sentence said, you may not need to focus on the structural portion. You may simply look at the meaningful ones. And when you look at the meaningful words or keywords, you surely get the answer. And Tricia, how many of yours are correct?
I think so you haven't asked Clarissa, you asked me just now.
Okay, and Clarissa, sorry.
I got all correct, sir.
All right. So now we'll move on to the next portion. If you can look at the questions from 13 to 24 on here. The patient is Jack Venter and he has some skin lesions. You will have the audio played for the same. Okay. And just feel completely relaxed. Just try to give the best you can. And you do not worry about the score. You simply try to go through it and get the experience. We'll deal with the correct answers and correct answers later.
You hear a consultant dermatologist talking to a patient called Jake Ventor. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Jake Ventor, please come in and take a seat.
Thanks.
Okay, now I understand from your GP that you've got a problem with your hand?
Yes, I went to see you a couple of weeks ago because of a sore on my left hand. I've had it for years, but not all the while. You know, it appears, then it gets better, then it comes back. It's here on the palm. It's almost gone now. But she wasn't sure what it was, so she said I'd better see a dermatologist. She took a photo. Did you get that?
I did, yes. So tell me about the condition, how it feels and...
Well, I always know when I'm going to get it because I have this itching beforehand.
Right.
I wake up at night wanting to scratch the area, though I try to stop myself.
Good.
Then a few hours later, I get one or two little blisters, and they gradually get bigger and join up into one big one. It all feels a bit hot, and the skin around it goes red. When I showed this to the doctor, she used the word chaotic to describe it. Anyway, it gradually dries up, and I get a scab. Then after about 2 weeks, that falls off, and there's just a little red patch, like you can see now.
Okay.
I've been getting it for years. I actually got it the first time when I was in China in the 1990s. I had a job there for a couple of years before I came back here. That first time, I also had a similar sore on my chest, but that's never come back. But the one on my hand, that comes back every year or so, but never in exactly the same place. I thought it had sorted itself out because I didn't get it for a couple of years, but then it came back.
Right.
So there's no pattern. It's not getting more frequent or anything, and it doesn't seem linked to anything in my daily life. Like it doesn't seem to happen when I'm run down, for example, or because of anything in my diet, or if I'm under a lot of pressure at work, that kind of thing.
Okay.
So the doctor thought you needed to have a look. Also because I had a malignant melanoma on my back that was removed in 2006.
Right.
It was at quite an early stage and it hadn't got too deep.
Okay, well, that's good. Still, I'll just have a look at your back.
Mm-hmm.
Was it down here?
Yeah, that's right.
Okay. Well, yeah, that all looks absolutely fine. Well, I don't think you need to worry about anything sinister here. By the way, have you ever had cold sores?
No, never. But I did wonder if this thing on my hand was something like that. In fact, I wanted to ask you about that. There's an antiviral cream you can use, isn't there, to stop them developing? I wondered if you could prescribe me something like that.
Look, the trouble is these work well on the mouth because the skin's very thin there, but I'm afraid they won't have any effect in your case because the skin on your hand's so much thicker.
Oh, I see. Well, something else that worries me is whether there's a chance of infection. Should I be covering the place up?
No, you don't need to unless there's broken skin.
Right, good.
It's fine.
And it's not actually having an impact on my quality of life or anything like that. It's something I can live with. I mean, I have done for all these years.
Okay, so really, the reason you went to the doctor after all these years was just to see if there was any way we could prevent this happening.
Yeah.
Okay, well, at this stage, the best thing to do is organise a biopsy. It might be a bit uncomfortable, but it means we can rule certain things out.
Okay.
Okay. Okay, let me tell you the answers. For question 13, the answer is palm. I'm not dictating the spellings because if you can get the word and even if you might spell it slightly incorrectly, it is acceptable. Okay. So for question number 13, answer is palm, and for 14, it is itching or itchiness or pruritus. For 15, it is blisters or little blisters. Either of them is correct. 16th is chaotic. 17th is chest. 18th is frequent. 19th is diet or anything in his daily life. 20th is removal of or malignant melanoma. So the meaningful word is melanoma. Okay, so even if you write removal of melanoma or even if you write malignant melanoma, it's going to be correct. 21st is cold sores or herpes simplex or herpes labialis. Either of them is correct. 22nd is an antiviral cream, okay, or simply antiviral cream. 23rd is broken. 24th is biopsy. All right. So, yes, Tricia, may I know how many are correct?
I got all correct, sir.
Very good. In the previous section, Tricia, can you please tell me again, how many were correct and which numbers were there? I think I missed them.
I got 3 incorrect, which is question number 2, number 6, and 11.
Okay. Okay. So they were proper nouns like, acupuncture. No, 11th was combination of treatment. So it was different. 6th was events organizer. And the question number 2 was right leg. So see such, errors, I would not say these are mistakes. These things happen. So these, you'll be able to score really well. As you can see in the second section, you scored. Once you practice more and more, you'll be able to overcome, such errors. So Clarissa, your answers for how many are correct for the second section?
All are correct, sir.
And Liang?
All correct, sir.
Very good. All right. So we'll jump on to part B. You remember in the reading task, we've tried to get on to one or two multiple choice questions. There you had read a single paragraph of the piece of information and you extracted the context and selected one correct answer. Okay. In here, you have to listen to the audio one by one for question number 25 and then for subsequently for 26 and likewise, and you will be solving the question. So for each question, you have an individual recording. Okay. Anyway, I'm going to play it all together for question number 25, 26, 27, 28, 29, and 30. These are multiple choice questions. You have no negative marking here. So do give it a try. If you, the most important thing is to listen to the recording carefully. Remember, you may not get sufficient time to look at the individual questions. However, even if you get few seconds here and there, try to understand the question first, and then obviously everyone tries to do so. The thing is, the moment the recording begins, it will not jump at the answer. So for some questions, you will have to understand the overall recording, then you may get to the answer. For many recordings, the answers will come after 20 seconds or 30 seconds of the talk. So initial 15 seconds, let's say, you have time to look at options A, B, C. You may give yourself, you may only look at options A or B. Some people, some students, what they do is they would not look at all the options. They would just look at first two options. Either they'll look at the last two options, that are B and C. These are all strategies. The best thing is to, I would always say, to listen to the recording carefully, and accordingly you can select the answer on the basis of whatever you heard in the recording. And again, the answer sometimes, will be the overall gist of the recording. Sometimes it could be a keyword that can match with the option. Sometimes it's a single sentence which can connect to your answer. So try to listen to it very, very carefully. Should I put it on now?
Yes, sir.
Yes.
Okay. So here's your part B.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse briefing her colleague about a patient. Now read the question.
Mrs. Green was admitted last night for pneumonia. She came in yesterday with a cough, fever, dizziness, and chest discomfort. She's a healthy 60-year-old with a history of right knee replacement 5 years ago. She's on a regular diet and has no allergies. She's at high risk for falls due to her dizziness. We changed her IV antibiotics to oral, which she's tolerating well. Her assessment is within normal limits, except for some mild shortness of breath and wheezing. Her vital signs are stable, oxygen saturation is 98% on 1 litre, and she's been comfortable during my shift. Around 5:30, I gave her 2 paracetamol for minor pain, with good results. She has an 18 gauge in her left arm. She's got normal saline at 15 mils per hour.
Okay.
Question 26. You hear the manager of a care home for the elderly talking to the nursing staff. Now read the question.
Now, a quick word about the administration of medication. It's great to see how carefully you're all following the new guidelines, and thanks to this, error rates, which were always below average anyhow here, have dropped by 40%. The surveys we've done also throw up some interesting findings, like mistakes being more common in the morning than afternoons or evenings. We're not sure why, but there's a clear pattern. Also, we know that being disturbed for any reason while working out and preparing doses is a common reason for mistakes. So please, try and avoid distracting your colleagues while they're doing this. Finally, we must be on the lookout for drug interactions, side effects, and patient sensitivities. Fortunately, we haven't had too many problems of this nature, but the care needs of the vast majority of our residents are often quite complex.
Question 27. You hear part of a morning briefing on a hospital ward. Now read the question.
Right, so overnight admissions to the ward. Greg, could you start us off?
Sure. We have Sue Deans in bed 5. She's a 54-year-old female who was brought into the emergency department by police overnight. She has a history of poorly controlled paranoid schizophrenia. She presents with chronic persecutory and paranoid delusions and also significant thought disorder. She's to remain in high dependency unit care until the stabilisation of her symptoms. We'll be observing her every 15 minutes and monitoring the level of her distress, psychosis, and any response to interventions offered.
Okay. I'll review the clinical and detention status this afternoon. Now, what's the plan for discharge?
Social work interventions required for placement and community support options, and that's been booked for tomorrow. Also, an application for the appointment of legal guardian may be required.
Right. We will consider that at tomorrow's ward round.
Question 28. You hear part of an antenatal consultation at a GP practice. Now read the question.
Mrs. Summer, how can I help today?
Well, I just wanted to check something.
Okay. So you're having a home birth?
Yeah, though everyone's on at me about going into hospital. I had my last child there, but I'm determined to be at home this time, to feel more relaxed as well as safe. But I wondered about an at-home epidural if I wanted it. Going without wouldn't put me off, though.
An epidural's out, I'm afraid, because we can't do it without an anaesthetist. Just pethidine or gas and air. But they're very effective painkillers.
Yeah, pethadine's good.
And you had a bad patch after giving birth last time.
Yeah, I got really depressed. I couldn't understand it. It was short-lived, though, and I'm better prepared now. It can't be prevented, but I have read up about coping strategies.
Question 29. You hear a trainee doctor telling his supervisor about a problem he had carrying out a procedure. Now read the question.
So how's today gone, Harry?
Well, I'm afraid I had a problem taking blood from Mrs. Harris. Finding a vein. I suspect her illness means she'll have had a number of cannulas inserted over the weeks she's been here, and that's led to collapsed veins.
Well, that can happen with long-term elderly patients, and it's distressing for them if the procedure isn't done quickly.
Oh, I mean, she endured it without a murmur.
Oh.
I'm sure I would have made a fuss in similar circumstances.
Well, I'll supervise you the next time you do it.
Question 30. You hear a doctor talking to a teenage boy who has a painful wrist. Now read the question.
Now then, I understand you fell off your skateboard some days ago and injured your wrist. Is that right?
Yes, I slipped and put my hand out to save myself. My mum says I've sprained it.
You certainly got some swelling and bruising there. But I don't think your mum's right in this case. Does your wrist hurt?
It aches, but the pain's worse when I try to grip something.
Right, well, I suspect you've broken what's called your scaphoid bone. It's a classic injury resulting from what you describe. I can't feel any other fractures. but you'll need an X-ray to see where the two ends of the bone are. If they're not meeting up properly, you'll need an operation to sort that out. But let's see the results first.
Okay.
Okay. So I'm dictating the answers now. For question number 25, answer is B. Right? B is for Brazil. 26th is A. 27th is A. 28th is C. 29th is A. And 30th is A as well. So please tell me like how many of yours are correct. Tricia?
Sorry, sir, can you repeat the answer?
Yeah, please go on. Say that again, Liang.
Sorry, sir, can you repeat the answer again?
Yeah, for question number 25th, it is B. Okay, then 26th, it is A. 27th is A. 28th is C. 29th is A. And 30th is A as well. Clarissa, how many are correct?
All are correct, sir.
Patricia?
Me too, sir. All are correct.
And Liang?
I got two wrong, sir.
Which ones?
Question number 27 and 28. Stupid.
You hear part of the morning briefing. Hospital or okay, what is the plan today? Okay. So the idea is this was the first listening task. I'm going to make sure that you will receive the files. Okay. And I will also make sure that you will get files to practice further. All right. Now, if you look at part C, okay. So when you look at part C, you will find that part C assesses your ability to follow a recorded presentation or interview on a range of accessible healthcare topics. You will listen to 2 different extracts, okay, and you will answer 6 multiple choice questions for each extract. So you got to solve 12 questions altogether. You may expect 2 presentations or 2 interviews or 1 of each, right? So in general, the structure remains same, that you have to solve the multiple choice questions, okay, and when you practice, try to grasp the recording. Sometimes you may not look at the options. You simply read the question and then listen to the record. It is just the practice, we are not in the test. So the idea is that you listen to the recording very, very carefully and judge whether just listening to the recording very carefully without having looking at the options, can you get, once the recording is over, can you get the answer correctly? If not, then obviously what everyone does is, we will read the question, we will listen to the recording, and we'll keep looking at the options as well. So ideally, most students do this only because this is a very layman's technique. We are actually allowing our brain to do multitasking. So the second method is, dependent on case by case basis. The third one, as I mentioned earlier, that you may look at only options A or B, or you only look at options B or C. And the moment the recording begins, it will not just straight away give the answer, so you'll still have time of 15 seconds or so to look at the options in detail. In that way, you can actually get the correct answer. Having said that, as I said earlier as well, students have their own way of doing it. So try to go about your section C as well. Once I'll share the file, you'll be notified. And I will also share the practice material for reading as well, extra test as well. And I'll see to it that the files reaches you. The files reach you in time. Okay. So for section C, I'm going to share the file on the Zoom chat box, and I'll see like if it is there with you. Okay. And we'll connect tomorrow same time